Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Senese. Glad to have you on board. If you're watching us live, you can watch us on Facebook, LinkedIn, X, what am I forgetting? YouTube and Kick. All of those are coming to you live at the same time every Saturday morning at 10:30 a.m. Central Time. If this is your first time checking us out, be sure to go to our website at UroPatient.com, the best place to learn more about us. That's the best place to see more information and all of our past episodes. Boy, we got a bunch of them. So check out all of those past episodes for something you might have missed. Also, we've got these helpful information handouts that I put together. You can go there free of charge, just copy them and take them with you to your doctor's appointment or just have them as a reference. They're yours. Go ahead and get those. Hey, we got a great episode for you today. Be sure to always join us every week. And here we go. All right, so today I'm going to talk to you about how to survive prostate surgery. Now, I got the idea because I just got back from Florida where my brother had to have prostate surgery. And since I'm retired and a urology expert, I decided to go down and take care of him. So I did. So it kind of occurred to me there was a lot of things that I think I helped get his recovery to be a lot better because of some of the knowledge I have. He certainly felt better having a urology nurse taking care of him because, of course, he was nervous. What guy isn't, right? So anyway, I thought, I probably should have an episode on this for UroPatient because this is really some stuff that I don't know that I necessarily talked about. And these tips are simple tips, but they make a lot of difference. So anyway, let's go into those. So again, what to expect after prostate surgery. Now, the most common things guys are going to worry about is going to be pain and followed by the catheter. Now, the pain, you've had surgery and there's different ways they do the surgeries. I can't argue there's discomfort with surgery, but it can be managed. There's steps that you can take to make this smoother. And that's what my goal is, to help to make this a smooth transition. I've seen people who have had surgeries that have had more side effects because of the aftercare than they probably needed to have. So take these tips, see how that works for you. Now let's talk a little bit about prostate surgery. So prostate surgeries occur for two reasons. One is prostate cancer, where the prostate's removed to get rid of the cancer. Now, that's not what my brother had. The other one is a blockage. So when your prostate starts to block you off, there's a lot of what we call these minimally invasive procedures that are done. However, as your prostate gets really big, and his was really big, then you need to do something more dramatic. And that's where they do things like a simple prostatectomy. Sometimes they can go in there and do what's called a TUR of the prostate, where they just trim it out. But he actually had to have it surgically taken out. Not the whole prostate, they just take the inside. I kind of explained to him that if you imagined an orange and you went in and you took the inside of the orange out and left the peel, that's pretty much what a simple prostatectomy does. They open up the prostate, they go and they remove the inside of it, sew it back up, and you're done. Now, he had it done robotically. And everybody thinks the robot makes it like no incisions. And he's like, hey, I got cuts all over me. Well, you do. Every one of those little machine arms you see there, the robot arms, has to have a way to get in there. So they make a little incision for each of those. And when they get that tissue out, they have to somehow get it out of you. It's not going to come out through those little holes. So they make a bigger hole, not huge, but a bigger hole to get the samples out. That's what you're going to have for post-op pain. Now, luckily, I can tell you that as somebody who's been doing this for 40 years, the pain that you receive from a big incision like surgery is far less than the pain you're going to, you'll have far more pain with that than with robotic procedures. Because the incisions are small, they don't tend to cause as much discomfort. But, this one thing my brother found out, is they have to fill you with gas in order to inflate the abdomen to put those robot arms in. And the gas they use, they can't get it all out of you at the time of the surgery. They try to get most of it out, but they leave a little behind. That can cause some pain, especially up in the kind of the shoulder area. And it's a nerve that gets bothered by your lungs that sends up that signal. So you may notice that, but it goes away in a couple of days. Want to get rid of it quicker? Do what I told him to do. Walk. I got him out there walking around. It helped. I think he had 1 day's worth of discomfort from that. The incisions, we're going to talk about that. Now, let's go into the hospital stay, because this is really important. Most of the time, nowadays with robotic, don't be surprised if you're going home the next day. And then you're going to want to go home probably the next day too. Hospitals are no fun. But you have surgery and you can go home the next day. The first day, after surgery, you're going to have this fluid going in and out of your bladder to wash out any bleeding and clots to prevent those from happening. So you'll see all this fluid coming in and out. And, you're not going to feel that great because of anesthesia effects. But as soon as it's safe and your doctor's giving you the okay, get up and walk. Movement is your friend. You want to move as best you can. Now, the second day, which would be surgery was day 1, day 2. The second day I came in to see him early in the morning, and he said, boy, I want to get out of here. And I said, I don't blame you. Let's get you out of here. They came in to give him his medication for pain. He had requested something for pain, and they were bringing in a shot. I told him, I said, if they give you a shot, they can't send you home on injections. You have to be on oral. I said, why don't you try the pain pill unless your pain is really that bad? Well, I think he just didn't want to have any pain. So he did. He took the pain pill. It was sufficient. He was able to go home. Best thing you could do. Try not to have to take the narcotics more than you need. Now, here's a big clue that I have done with him, and I've done it with my wife, who had her knee operated on, and myself. So I'm not just making this up and saying, hey, this is what I believe. I think the best thing you can do is not take the narcotics. Yes, they will take away the pain, but they make you drowsy. They slow down your bowel. You don't breathe as well. You don't move as much. All those things are going to slow down your recovery. Tylenol, good old acetaminophen, is probably one of the best pain maintainers. It'll keep pain away that you can use. However, there's a trick to taking it. And the way people take pain relief is they wait until they've got enough pain that they want a pain pill. Well, these don't work instantly. The shots are pretty quick. So you get a shot and boom, hey, I feel great. Pills, about a half hour or so. And that pain is going to keep building and building and building. Tylenol won't handle that. You're going to have trouble if you do. But if you get on Tylenol around the clock, I don't mean take it when you hurt. I'm saying every 4 hours, take a Tylenol. My recommendation, ask your doctor to be sure that it's okay for you, is to take a 500 milligram Tylenol. That's the extra strength. Just one every 4 hours. Now, the recommended dose is taking 2 of those every 8 hours for a maximum dose of 3,000 or 6 pills. Now, that can vary if you've got liver problems. And Tylenol, even though it's over the counter, can be a dangerous pill. Too much of it can harm your liver. So best thing to do is to take it every 4 hours, round the clock, no matter what. It will keep your pain level tolerable. It's not going to be totally gone, but it's going to be tolerable. But you're going to be wide awake. You're going to be able to get up and move around, walk around, breathe normally. Your stools are going to, not get constipated from all that narcotics. Trust me, folks, you'll thank me for this hint, if nothing else. And that's all surgeries. I had taken care of patients before I went into urology. I started in orthopedics, and bone pain is typically known as one of the worst pains there is. And I've had back surgery, and I can tell you that I followed my own rules, and I'm glad I did. My wife had knee surgery, and she never took a pain pill outside of the Tylenol routine. They gave her a block. She went home, so she didn't have much pain. I got her on the Tylenol right away. She did great. I mean, for a knee surgery, you got to really do a lot of recovery exercises and stuff, but she did great. So check with your provider, see if they agree with that. Have the pain pills on hand just in case. We don't want you suffering, but you can probably get by without. Now, here's the big thing, the catheter. This is going to drive you crazy. Some people tolerate them better than others, but the tube that we typically put in patients after surgery is pretty big. And because of the size of the tube, it's going to be pretty irritating. So most patients are not going to be happy. And you're going to have this in for about a week. So keep the bag empty. That's a good idea. But I'm going to go through a couple of tips that I think are really important. And this is going to be your typical setup for your catheter. You're going to have this catheter, and this is the leg bag. Leg bags are fine except they don't hold much. So sometimes you'll want to wear one at night. Now, unfortunately, the hospital my brother went to, this is how the setup was. There was no extension tubing. I like to have a piece of tubing off of the end of this, but it didn't exist. So the leg bag was right on top of the catheter. Now, I like to have it secured to the leg. As you kind of see in that picture, I want to have this taped off, but I don't like putting tape on a Foley catheter itself. Don't tape this part of it. So I'm going to use some tape. I don't recommend masking tape, but it shows up good on the video. And I'm going to show you how I recommend taping it. You want to tape it to your leg. Of course, I can't really demonstrate with my leg here, but I'm going to tape it. So this would be the extension tubing if it existed, but he didn't have it. So what I did is I said, let's just wear the big bag. He wasn't in the mood of going out places, so around the house it works fine. Keep the big bag on. That's great. But it's got that extra tubing. You can see this. This is the full-size bag that you can wear. They call it a nighttime bag. It holds a lot. It's not a bad idea. And be sure to get instructions on how to empty these. I did do a video on how to do that, but they're all different. Don't get home and try to figure that out. So what I like to do is I tape it to the leg by putting the tape around the tube like that, and then use that sticky part so it's taped like this. Now, of course, the catheter's attached here. That's going to keep it from pulling against your bladder. That's going to make you a lot more comfortable. Have them send you home with the tape because that's going to make you a lot more comfortable by taping it to your leg. Here's another clue. When you tape it to your left leg, next day, move it to the right leg. Back and forth. You don't want to keep it always pulling the same way because what'll happen, coming out of the penis like this, and it's pulling this way, it's going to pull against that side of your urethra. So you want it to always be switched to which side it's pulling against. Otherwise, I've actually seen it erode through the urethra itself. You'll see a little groove form around the outside of the penis, right where it's coming out. Not good. So it doesn't typically happen in a week's time, but why not rotate it? So change it every day, keep it clean, all that good stuff. Empty it when it gets full. So as I said, secure it to your thigh to prevent tugging. Leg bag at night or during the day is nice because it's smaller, lighter, you get more portable. If they give you the extension tubing, I recommend it. If they don't, I recommend going with the large bag all day. Call your provider if you're having severe pain or no urine flow. Now, by no urine flow, I mean it's not that you haven't seen any flow in the last 5 minutes. You're not seeing any flow for like 4 hours. And to keep infection down, daily hygiene is necessary. Ask them about showering. You should be able to shower the next day, especially if it's a robotic thing. Showering's good. No swimming in the pool, no tub bathing, but showers are good. Keep it clean. If you get a low-grade fever, cloudy urine, that could mean a sign of an infection. Foul smell to the urine, let them know. And hydration. Keep hydrating yourself. You don't have to run to the bathroom. You got a catheter bag, so keep yourself hydrated. Now, don't go nuts, but plenty of fluids to keep yourself flushing that through. You'll see that the urine is going to be kind of a red color for a while, and then all of a sudden it'll start to look like iced tea. Iced tea means it's all no active bleeding. It's all old blood. And then the next thing you'll see is it's going to go to clear, normal-looking urine. You may see a little blood on and off even after that, so don't panic if you start seeing blood again. It takes about 6 weeks for that to re-heal itself on the inside. Now, always good to know when to contact the doctor because you don't want to sit there and should I worry about this? Should I not worry about that? Severe pain. You shouldn't have severe pain. Again, follow my recommendations. You'll probably have minimal pain. High fevers, 101, 102, those kind of fevers can be dangerous, so call the doctor right away. They probably are going to send you home on some antibiotics, but it could have a resistant organism, so the antibiotic may not work. Again, if that catheter's not draining 4 hours and you emptied it 4 hours later, it's still empty, you might have a problem, especially if you're getting a strong urge to urinate. So, fixable, don't panic. Doesn't happen too often, but it could. You may see some clots in the bag, and some people, they get worried. They see a clot inside the tubing, especially bring this one back up here. This tubing, because it's so big, you can really see it. Or in the bag itself. Blood clots are just blood sitting around. It clots, but it's not like a blood clot like you get in your leg or your lungs or things like that you have to worry about. These clots are normal. You'll see them. As long as they're flushing through the tubing, you're going to be fine. So don't let that be something to panic you. So I hope that was helpful. I'm going to leave you with some final tips for you to make sure. These are the things before you leave the hospital you want to make sure you do. Number one, get a roll of tape, like I mentioned. It's going to be a great thing to have that tape so you can tape that Foley catheter down. Number two, ask the doc to give you a prescription for an antispasmodic medication. The bladder spasms could be the worst part of this whole thing. Because that catheter's in there irritating your bladder, it causes it to contract, and it's like I call it a Charlie horse of the bladder. There's medicines that can help prevent that or at least limit it, and there's a whole bunch of them out there, so whichever one they want to prescribe to you, ask for something. The other thing, a stool softener. Now, even though I told you about my handy-dandy trick of the Tylenol, you may be taking some narcotics. Even if you're not going to be as active as you normally are. You also receive narcotics and anesthesia, all of which affect your bowels. You don't want to be straining to move your bowels. You need to keep things moving soft. A basic stool softener will go a long way. Ask them, what should I do if I get constipated? You don't want to be struggling with constipation. And finally, my last tip is make sure you go home with a spare bag. I found these bags have sometimes develop a hole or a seam rips or something, and now you got a mess. So if you don't have a bag, you're trying to run out to find one. It's not the easiest thing in the world. Get a spare. I hope you find all this stuff that I've told you helpful, and we'll see everybody next week.